have it on record yet, forcibly.
It's 14 people, right?
Now it's, no, but now Scott's up. I can't do it.
26 people, 14.
Call them out.
Yes. I told her.
5, 6, 7, 8.
Good evening, everyone. Welcome to the Regional EMS Council of New York City. Is this too loud? I hear my echo. My name is Martina Baccarella. I am filling in for Yadidia Langsam. Dr. Langsam could not make it today. We are on Randall's Island. Thank you, FDNY, for letting us use your beautiful facility. The mics work, the lights are on, and we have donuts and coffee. For those of you who have been complaining about coffee, we have coffee this time. Thank you for whoever provided that.
That was Doug.
Thank you. It is Tuesday, September 24th. Meeting should have started 8 minutes ago, but I'm late as always. Thank you all for being here. Welcome back. So the first item on the agenda, we have a quorum?
We have to do a roll
All right,
call.
let's do a roll call.
When I call your name, please say present. Jason Zimmerman or Joshua Hartman. Chief Grace Cacciola. Chief John Nevins or Bradley Kaufman. Andrew Dahl. William Goffin. Daniel Mizels or Jory Gutzman. Robert Bristol. Max Goldafarb. Travis Kessel or James Downey.
Downey, present.
Gerald Gelbard or David Mekatansky.
Present.
Joseph Schenker.
Present.
Michael Rayola. Michael Vatch or Mordecai Lax.
Here.
Martina Baccarella.
Present.
Marie Diglio.
Here.
Nancy Benedetto. Arthur Cooper. Robert Krupe. Megan Kessel. Manfred Fuchs. Benjamin Fay. Michael Combs.
Here.
Yadidia Langsam. Brian Levinsky.
Present.
Dennis Laurie. Warren Barsley. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. We have a quorum.
All right, we have a quorum. Thank you all. I know Michelle worked very hard to make sure everyone came in and responded, so I appreciate the fact that you guys responded to her emails and texts. Thank you, Michelle. I was one of them. I didn't respond to emails. I respond to texts.
I'm going to call the meeting to order and approve the minutes.
Okay.
Motion approved.
Thank you. So the minutes were approved and now the correspondence report.
I just don't have my own agenda, so I need to share yours.
I'm sorry.
That's okay. Okay, so we just approved the minutes of the June 25th, 2024 meeting. And now we will do correspondence report. Well, I'll read it for you. Let me just sign this. Okay, the attendance sheet's going to be going around. Please sign in. This is correspondence report. It's a little long because it covers from June to now. The following members requested to be excused: Daniel Mizels, Robert Krupe, Manfred Fuchs, Nancy Benedetto, Jerry Gelbard, Jason Zimmerman, David Benelli, and Dennis Laurie. We have no new information from FIDNY EMS. The State Bureau of EMS published the proposed changes to EMS vehicle and equipment requirements for certified ambulance and ALS services into the New York State Register on July 10th, 2024. We did have a sub-tag work on reviewing these proposed changes, and their report will be coming up under the ambulance committee. Vital Signs 2024 will be held in Rochester, New York on October 17th to 20th. And a conference flyer was distributed by email to all our members. New York State Division of State EMS posted several education-related job openings, including positions for education investigators in licensing and CME, a unit leader, project manager, and a chief for the practitioner licensing and credentialing unit. These roles involve responsibilities such as managing applications, ensuring compliance with standards, overseeing projects, and supervising teams with application deadlines. Sounds very complicated. I'm not sure what these people do, but we'll find out, I'm sure. Now, New York State enforcements, these are our EMTs and paramedics who have had problems with the State Department of Health. And I'm only going to read the names of people in New York City. People from outside New York City, such as people from Syracuse or whatever, they'll be in the minutes. There's a website for the state that's always in our minutes that you can go anytime to see who is under enforcement or revocation. So the first person is Che Vinston, New York, New York, number 251439. This person's certificate was revoked effective September 10th for violations of 10 New York City RR Part 816. Second person, Louis Carrillo from Corona, New York, 272873. His certification was surrendered effective August 7th. This is right, for 134 violations of Title 10?
Yeah, that's correct.
Wow. Okay, so it's definitely surrendered. Surrendered is really the same as revoked. It's gone. Harold Serrano from the Bronx, number 449474, suspended for 1 year effective August 20th for violations of Part 800. The suspension was stayed pending successful completion of 3 years probation. He's assessed a civil penalty of $4,000. $2,000 is stayed pending successful probation. Okay. And all the others are from outside New York City, which makes me happy. Enforcement actions for both providers and agencies can be viewed on the New York State BEMS EMS disciplinary actions enforcement actions page, and the website will be in your minutes, and you can always call the offices of the council if you need it. We did not receive any communications from New York City Department of Health. Okay, ambulance agencies. Forest Hills Volunteer Ambulance Corps contacted REMSCO and said that they would be very interested in providing the management and operational issues for Corona Community Volunteer Ambulance Corps. It's another agency that's having some difficulties. We are still waiting for a transfer of operating authority because they were told if you want to do this, you need to apply for it. We haven't received any application yet. For sponsors. So there were Part 800 public comment period also for language in the educational part of Part 800. Christine Alvarez from LaGuardia Community College submitted changes to clarify language and to make it more uniform. Staten Island Emergency Medical Training Center is recruiting a full-time teacher for EMT classes at John Dewey High School, and they're offering an opportunity for EMS professionals to shape future healthcare education. And you should contact Billy McDonald at Staten Island EMT if you are, or anyone's looking for a full-time education position. And that email address will be in the minutes, or you can call Michelle and she'll give you the email address directly. CFR EMT and paramedic original and renewal course applications were received from the Center for Allied Health, St. John's University, FDNY EMS, Northwell Health, LaGuardia, Staten Island EMT, B&H, emergency care programs, emergency aid training, rescue training, Inc., and Borough of Manhattan Community College. And all applications appear complete for documentation purposes. Okay, so this is the core sponsor renewals. Okay. The Regional EMS Council is responsible to review applications for renewing core sponsors. Basically, what we're checking for is that all the paperwork's there, because there's nothing else that we are allowed to look at. We're not allowed to do site visits. We're not allowed to comment on policies and procedures. So basically, we're just saying that, yes, we received them and that we forward them on to Albany, but we still need to have a vote on that. So I need a motion from someone to recommend approval of these centers that that I just mentioned. So who wants to make the motion? Grace, Chief, thank you. Who wants to second that motion? Okay.
What did we just second?
Core sponsors are renewing their applications. Do you want me to list them again?
No.
And what we, you're such a pain in the neck.
We're seconding that their
Well-
applications are complete?
Okay, wait a minute. I think okay, if these are just applications, we
Yeah.
don't have to
We don't
approve
have to
them.
do anything yet.
Okay, we don't need to, I
That's
thought
what
they
I
were
thought.
renewals. Sorry, my mistake. So these are places that have actually sent in courses. I apologize. Okay, and we have a whole slew of CME, which will be just listed in the REMSCO minutes. New York State Volunteer Ambulance Rescue Association sent out a newsletter to inform everyone that the State Bureau of EMS released 2 new policy statements. These policy statements can be accessed through the DOH website. They outline requirements for EMS certification in New York and the evaluation of practical skills in advanced EMT practitioner courses. Okay. Westchester Regional EMS Council hosted a New York State Certified Instructor Update workshop on September 22nd. And okay, the offices of the council sent out agendas, minutes, and associated attachments for this meeting. We sent out an email reminder to all the agencies about the 2024 protocols, which begin October 1st. Okay. An updated contact request was distributed with the conflict of interest form. So I don't know how, were they sending this back to you by email?
It's electronic.
Okay, it's electronic. So if you haven't done it, please do so. And the program agency and regional council contracts were submitted July 18th. And I don't know if we've gotten paid for it yet, but that would be nice. And that's, okay, we have one more item, and this is really sad. We received a communication from St. John's University, their EMS training center, that it's shutting down its paramedic and EMT training courses. The last paramedic class is graduating February 2025. This is a real problem for New York City to lose any of its ALS training centers. So I know that we want to send more letters to the university asking them not to do this. I don't know if there's much hope, but we'd like them to know that the medical community does see this as a loss. I think Scott said he was going to set
Yeah,
up a template.
So what happened is that over the summer, REMSCO chair has sent a letter to the president and the provost of the university, urging them to reconsider. At the same time, I believe senior care also sent letters to the leadership at St. John's University. So what the staff have done is we have prepared a toolkit for all the agencies. We're going to distribute through council. Can pretty much just copy and paste, pick a letter that you like, and then you can add your own information to it and copy and paste on your letterhead and send to the university to urge them not to shut down the program, or at least reconsider an alternative. So. And just FYI, we did not receive any feedback from the leadership at St. John's through the letters that we sent.
Thank you, Scott. And that's the end of the correspondence report.
Thank you, Marie. Next item on the agenda is a staff report, emergency preparedness update with Joe Maneri.
Currently, the staff is working on a couple updates to the learning management system to build out some future improvements to the system, make it easier for our paramedics and our docs to renew their credentialing. We are also exploring development of programs for future trainings on EMS interactions with patients suffering from mental illness and mental health episodes, de-escalation training and things of that nature, seeking out grant funding for those projects. And that's all the updates we have for now.
Thank you, Joe. Next item is the program agency update. Scott?
We have not yet received our program agency contract from the state. We did receive the REMSCO award letter. The state informed us that they're working on it, and that's all I have to report.
Thank you, Scott. And the next item is the ambulance committee report.
I just wanted to. I can't let this just slide. The fact that the State Department of Health still has not gotten contracts for program agencies when our contract period started July 1st it's unacceptable. There is no reason that these contracts are not done. At least they have not given us any real reason for it. I know that we'll be sending, I think we're sending letters to REMSCO at least. And for those of you that are interested in contacting your elected officials as private citizens, reach out to Scott. I'm sure he has template letters to let them know what's happening, because legislators make the laws, and the Department of Health, by not giving us contracts in a timely manner, don't allow us to fulfill our statutory responsibilities. So I just wanted to make that clear. Thank you.
Don't turn off your mic so quick. Ambulance committee
I
report.
thought Scott was going to say something.
Oh.
No, okay. 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 The ambulance committee met right before this meeting. I think most people were here, so we could make this pretty brief. Okay, we had no applications for transfer of operating authorities. We had no determination of public need applications. And for those new members here, I think, do we have anyone new here who has never come to a meeting? Would you mind introducing yourself? We should have done this at the beginning of the meeting, sorry.
My name's Benjamin Fay. I'm an emergency physician. I work in Queens at NYPQ. Work closely with Dr. Krupe, who I think many of you know. I was an EMT back in college and volunteered for many years doing that. And during residency, have had an interest in EMS education in my program that I did. Really excited to work with all of you, and yeah.
Welcome. We're in stereo. Okay, so if there's no one else new. Oh, okay, well, just introduce yourself again.
I'm Michael Combs. This is the first meeting I've been to, but happy to be here. I've been a paramedic, been in EMS for 10, 12 years, a few different places, director of operations for a community paramedicine program in New York. Yeah, happy to be here. Thank you.
Look at that, like playing microphones. Welcome. Okay, sorry. So I just, I noticed that as I was looking over. Okay, so for people who are only just here now. Transfer of operating authority applications are an existing ambulance service being sold or just moved into another legal entity. Determination of public need is when it's a brand new entity that wants to enter the ambulance system. So, and that's what we do here. Ambulance tag reports. We did have a report from the Volunteer Ambulance Assistance Group, which is chaired by Jerry Gelbard. And this tag is offering assistance to all volunteer services, basically to prep for the new state inspections. So if you know of any ambulance services that need assistance, reach out to Michelle, and then she will put you in contact with Jerry and his group. And they've done quite a bit of work over the summer, and that report will be part of ambulance committee minutes. And the Part 800 tag, do you mind doing a recap, Brian?
All right, so we formed a tag based on the public notice that was sent out by the DOH for the Part 800 regulation changes, specifically to equipment standards. We had a few concerns. So the tag, by the way, just consisted of commercial, volunteer, hospital. We have municipal. I think so. That covers everyone, right? Yeah. So there was a little representation from all groups on this tag. We reviewed line by line the changes and comparison. One of our biggest concerns was the waivers process for any equipment standards. Previously, it had allowed regional council input into that. The language for, so it actually, the Part 800 previously said the affected regional EMS councils will be solicited for comment on the services waiver request. That language and anything related to regional input was removed from the proposed regulations. Also, there was a lot of concern about some of the extra requirements they're adding to EASVs. Some were specific to EASV and not adding those requirements to ambulances, ALS, and other vehicles, which didn't really seem to make sense. Why, like a ALS first response vehicle or a BLS first response vehicle or an ambulance isn't required to have a certain anti-theft devices, isn't required to have drive cams, but an EASV, which in this region, a majority of which are privately owned, would have to have that type of equipment in. And there were also just some equipment, some things that were just questionable medical wise, stuff like short boards when spinal mobilizations really changed since the previous Part 800. The headbeds were still in there. There were a few, something about having chemical hot packs and 2 hot packs. I don't know what really that's going to treat, unless we're treating sprains. So we did submit. We put together a list. It was signed off by the executive committee. It was sent in for the public comment, and we're waiting to hear from DOH. What next steps they'll be doing, whether or not they'll be revising and be reviewed by REMSCO again, or they're just going to push forward with the existing draft.
Okay. And we'll make sure that we provide information. We'll make sure we provide information to the council as to what is going on with these proposed legislation. And the last item of business from the ambulance committee was a recommendation to send a letter to New York State Department of Health, asking them to identify the status of the transfer of operating authority application submitted by Ridgewood Volunteer Ambulance Corps for the transfer of Throgs Neck VAC. This was begun before the summer. I'm not sure if it was April or May. The application was sent in, and Ridgewood made significant financial investments to help this agency and join them. And we're waiting for the Department of Health's legal department to decide whether or not this is possible, even though we've told them that we've done this before. So we don't understand whatever barrier that they have identified, and we'd like them to respond to us in writing. So we're asking permission from the REMSCO to send this letter up.
Thank you, Marie. Next item.
Need a motion.
Oh, motion, sorry.
That's okay. So who wants to make the motion to send the letter up? I won't write it. It'll be a nice letter. Oh, God. Second? Thank you. And in favor? Anybody opposed? Any abstained? Carries. Thank you.
Thank you, Marie. Next item on the agenda is the Training and Education Committee report.
Ed met last month. This month was canceled. We tend to coincide with protocol. Since there was no protocol meeting, we did not have one. The biggest review item I have is the information on protocol update completion, which is really a little less than ideal, which is roughly 50% of ALS has completed the protocol update, and between 35 and 40% of BLS, as some are incomplete. They've started it, they didn't complete it. That's what the numbers are at. Joe has been pushing out updated requests for people to complete it, since we're able to communicate directly with providers, as this was assigned directly to them. And we can email them directly reminders to complete the training, which he has done more than once already. And looks like we'll probably have to do it again and remind agencies to remind their people to. So the protocols kick in a week. And the report.
Thank you, Marty. Next item is the Quality Improvement Committee report. Who's doing that?
What was there?
So the quality committee did meet this month. We have a new leadership. Dr. Redlener stepped aside as the chair of the QA committee, and Dr. Kosterko will be taking over. The main focus was the use of the First Watch program and the data analysis tool, and they're currently exploring new data analysis with New York State DOH to expand on what we are reviewing in the region. Anyone who is interested in participating with First Watch, please get in touch with Joe. He can, give you the steps on who and how we can get more people involved in using that platform for QA in the region. That's the end of the report. The next meeting, I think, is October 9th. Right? I'm not crazy.
Thank you, Dr. Schenker. Next item is the State EMS Council report. Who's doing that?
Dr. Isaacs just walked out. Oh. Hold on.
I'll give the report since I was there.
Okay, good.
All right. So the significance impact to the region is that the rescue medic protocol was brought up to medical standard and it was approved. That we did not go through the normal process, but it did get approved. And the report.
Thank you, Scott. 1 second. This is,
Here it is. Right. Okay. Doug, do you want to add anything for the REMSCO report? We have the minutes here if you want to.
Scott mentioned that the protocols were approved, but didn't go through the normal process. But other than that, is there anything else you wanted to add?
Actually, it did go through the normal process. There's no clearly time. The 30 days is not actually in writing. So it went through our regional subcommittees, the protocol, medical standards, and REMAC, and then went through the corresponding state committee. So it did go through the normal process. And there's not a clear policy on the time, actually. It's not in writing. So
Yeah,
I just wanted to clarify.
I was going to add, I think that we followed Robert's rules at every level The fact that it was brought up as new business at medical standards can be voted down at medical standards, at CMAC medical standards. It was not, and it went through the committee structure as it had to do so. So I know that they have concerns that we didn't bow down, but we did follow the right procedure.
I'm just gonna,
Marie, Jim Downey. I just want to add, I did not attend the meeting, but the Volunteer Ambulance Association will be preparing its normal summary of the meetings as a blanket special edition and send them out.
yeah, and we really thank you for doing that because those summaries are really helpful to us. I just got a copy of the our REMSCO minutes from the meetings of September 17th and 18th. Let me just pull anything out that looks like okay, the new approved definition of EMS. When was this approved? Emergency medical means coordinate system interoperable. It was, where did we get this from? The approved definition of EMS?
Nicevara and Onion worked together to come up with a definition, and it was submitted to REMSCO for as a
Okay.
working document.
So this is a working document at
I
REMSCO?
think so, yeah.
Okay, because this
It's
is
not in legislation.
Okay, that was my question. It's not in, no problem. That's why we're gonna clear it up now. You'll be getting this in as part of the REMSCO minutes. So take a look at this, and when we get the NYSARA report, we'll share that also. Because we should all agree on what these definitions are. Because it does look a little bit different. The one thing they finally did is, honestly, we got sick of hearing EMS provider. I had asked them to change it to clinician, and they dropped it down to practitioner, which I think at least that identifies that we're some kind of a clinician somewhere, instead of just, an ambulance driver. We are practitioners. Okay, integrating crisis stabilization centers into the EMS system. They're still talking about how to integrate mental health offices into EMS. It's a problem because our EMS providers have to go to ERs to get mental health patients medically cleared before. You can't just bring them to a psych center. Policy statements 2406, 2407, and 2408, all having to do with education, were approved. Okay. Oh, and Jim, you can confirm this legislation for the Medicaid reimbursement. No, that's
They call it TIP and TAD, treatment in place and transport to alternate destinations, was approved and signed by the governor. To implement it, there has to be a stipulation agreement signed with the federal government, since the feds pay 50% of Medicaid in New York State. So Richard Brandt is from the Department of Health, Office of Medicaid, is working on that stipulation. So it can take weeks, it can take months.
And this is limited right now to Medicaid. They're working on Medicare, but that's in the future.
Correct, just Medicaid.
Okay, so the rest of this really is going to be put into the minutes because it's really pretty long. But if you need a copy right away, just ask and Michelle can email it to you so you can see our summary of the REMSCO minutes.
Okay, next item is unfinished business. Is there any unfinished business? No? Any new business? No?
Wait, is election is under new business? Okay.
Any, so no unfinished business, and then we do have new business. We have the election, right?
Prior to that, I just want to give a report on TAC for recruitment and retention. And Mike, go ahead.
Thank you. Yeah, so just a quick update on the recruitment and retention tag. The past couple months, we've been working with a company, HBG, to they're an insurance provider or brokerage, and we're going to be partnering with them to provide health insurance, dental, vision to any EMS provider, EMT paramedic that has active account. This is different than what your employer can offer for full timers. This will be beneficial to people who have per diem jobs or who are in kind of like limbo or waiting period before their main insurance kicks in. It's much more reasonable than what you would find on New York State Department of Health in terms of costs and things. It ranges based off of, if it's a single person, family, what plan you decide, but it can be as little as $80 a month up to $500 a month if you have a family and things like that. But we have a presentation. It's about a minute and a half from.
Just want to summarize this real quick. So part of the effort coming from the state for recruitment and retention is that program agency is supposed to receive a small amount of funding for the program agency to utilize as part of the statewide recruitment and retention effort. Even though we don't have the contract yet, staff have gone to the board of directors, and board of directors REMSCO supports this initiative. What we're doing is that we have identified, other than salary being one of the biggest issues, the second biggest issue amongst our provider is the availability of healthcare insurance. So over the summer, the TAG worked on this project very specifically. And like Mike have mentioned, that we have identified the group that can provide these a la carte health insurance that does not, there is no open enrollment period. You can essentially purchase this insurance month to month as needed. Is very helpful for the providers who work like the 3 per diem jobs, full-time hours, but is not eligible for health insurance. And also for those who are in between jobs, that the first 3 months of the full-time employment, they're not eligible for the health insurance. So this is the product that's designed very specifically for these folks that we have identified. And like I said, the money to start this up is currently being fronted by the REMSCO, but we're seeking the reimbursement from the state as part of the program agency contract, which we don't have yet. So, and Mike, you could please go ahead with the presentation.
All right. Let's see here. Just gonna share my screen. It's gonna see if technology wants to comply.
Hi, I'm Ada, a member of the customer support.
Can you get the volume up? Yeah. Just gonna turn the volume up.
Hi, I'm Ada, a member of the customer support team at HBG. I'm here to share information about your benefit store. In this video, we will go over how to access your benefit store, your coverage options, purchasing plan, how to create an account, and how you can speak with our support team. You can browse your coverage options by going.
Yeah. It should be on.
Otherwise, it's gonna go through this and then there. It's gonna come, it's gonna echo on the recording side.
So I'm playing it through these speakers. It won't play through.
You're playing it through here.
Mm-hmm.
Okay.
It's coming through here.
Hi, I'm Ada, a member of the customer support team at HBG.
Okay.
I'm here to share information about your benefits store. In this video, we will go over how to access your benefits store, your coverage options, purchasing a plan, how to create an account, and how you can speak with our support team. You can browse your coverage options by going to the link on the screen on your computer or smartphone. Your coverage options fall into 5 categories: health, dental and vision, family protection, household protection, and resources for living. Before selecting your choice of coverage, please create an account. We'll need some basic information to get started. Once signed in, purchasing coverage on your benefits store is as easy as shopping online at your favorite retailer. First, you'll select the benefit that you choose to enroll in from the homepage. Once you're viewing just your product, select the option for who you'd like to cover yourself, adding a spouse or children. That will determine the price of your monthly premium. Simply add to your cart and complete payment information. There is no open enrollment period. Enroll whenever you're ready. We understand that getting coverage can be confusing and overwhelming. My team is here to help. You can contact us by phone, text, email, or on Zoom. Get your questions answered and find the right plan for you. Thank you for watching. If you have questions about the plans, please contact support@hbgnow.com. For questions about partnerships, please contact Christine Haskins.
Okay, so. All right, so we will be sending the link out to all the members of REMSCO. Feel free to play with it. And at the next REMSCO meeting, representatives from HPG Group will be available to answer questions from the floor.
Who would be eligible for this?
Any EMS provider in New York State.
And then who's going to be kind of overseeing that? And, you know, some guy gets fired from senior care, it takes him off the plan.
And that's the idea. So if they get fired from senior care, they're still an EMS provider in New York State. And now their family will not, you know, will still have us coverage. They can purchase it on their own.
So it's 50,000 people in New York State.
Allegedly.
Yeah, I think part of it is you're gonna have to have a valid EMT or paramedic card for New York State.
Like in New York State, yeah, 50,000.
Yeah.
Certified, okay.
Did I answer your question?
Big.
It is huge, yes.
Yeah.
I know I'm not the chair, but I just wanted to thank Scott and Mike for doing this. This is something that our EMS providers have always needed. So many of them go from job to job, and either job, like if you're doing 2 or 3 jobs at one time, you don't have enough time on any one of those jobs to get you health insurance. But now, because of this, they will be able to directly get health insurance for themselves and their families that will move with them because it's their health insurance, not going through a company. So this is really big. I know that the state may have wanted to try this at one time, but you know, with bureaucracy and state rules and all that, they can't move very fast. And Scott was very quick to be able to find a way to do this and working together. This is a great opportunity for our volunteers too. As long as you have a card, you're okay. So thank you, Scott. Good job.
I also want to mention that not only is there health, but there's also dental and vision. So if you have a plan that this could also be used as supplemental, if you have a plan that has poor vision benefits, you could also come in here and you could use this process to purchase vision or dental or whatever.
Is there co-payments and
Yeah,
co-payments?
there's a number of different plans. that you can choose from, and based on what plan you want, a deductible or copays are higher and lower will determine your premium, just like any other insurance. But yeah, the website is up. It's New York City REMSCO benefits.com, and we're gonna try to push it out next month, do a hard push right before open enrollment.
And does the person need to be aligned with an agency? Like,
No.
So as long as they just take a EMT basic
Yep.
class, but they're not a volley, they're not with a private, they can still get insurance.
Correct. As long as your card is valid,
Okay.
if you're an EMT or paramedic in New York State.
And just want to add that if you're involved with an agency, but even though you're not an EMT, but you are affiliated with like a volunteer agency, you're also eligible to sign up. So this is a fairly inclusive insurance plan. But the key here is that you have the ability to choose what kind of coverage you want. And this is the kind of insurance plan that's designed to really bridge the gap. It's not. You know, I'm not saying that all the providers will need to purchase this, but we have a sector of our providers who just fall through the crack. They are not eligible for employer-sponsored insurance, and the state insurance exchange is not exactly ideal. So this is just an alternative. This is another choice that they can have to make sure our providers are covered.
Well, thank you so much for doing that and working on that. Any other unfinished business? All right, hearing no more unfinished business to discuss, new business, the elections.
You want to do this?
Sure. Yes, okay, all right. All right, so the nominating committee of the Regional EMS Council of New York City, Inc. met via conference call on September 19th, 2024. Nominating committee members were Marvin Radin, Nancy Benedetto, Jeffrey Horowitz, Arthur Coupry, Marie Diglio, and Michael Raiola. The primary function of the nominating committee, which is comprised of 3 members of the board of directors and 3 members of the regional council, is to review the nominees for the appropriate provider representation and balance, as well as the expertise of the individuals in the area most appropriate for the particular period of the time the regional EMS council will elect officers. The following nominees were recommended for our officer terms beginning October 1st, 2024. The first one is Yedidia Langsam. Second is Robert Krupe, Brian Levinsky, and Martina Baccarella. If you don't know who that is, that's me. Officers of the term are for 4 years, ending in June 30th, 2026. That seems like a long time.
Like a prison sentence, yes. Let me I wanted to just clarify, we were supposed to have done this with the regular elections in June, but I forgot to add the officers onto the ballot. So we have to do it now just to officially place the officers for another 2 years. It is a 2-year term, yeah. So we need I'm sorry, go ahead.
Oh, okay. All right, so we just need you want to share this one?
No, go ahead.
We just need a final vote, so all in favor? Anyone opposed? I didn't see any hands. All right.
And nobody recused? No one's abstaining?
All right, it's unanimous. Carries.
Thank you very much.
Thank you, and it appears that was the last thing, unless anyone else has any new business. Motion to adjourn, it's 6:57.
Well, you got a game to
Seriously?
get to?
No, I don't.
Okay.
Ah.
Bye. Good night, everyone. Thank you very much.
And just want to
Thank you so
thank
much.
FDNY for providing the facility for us tonight. Thank you.